Now I will switch. Ahora hablo en español porque quiero
Now I'm going to speak in Spanish because I'd like to present two people who are going to talk about the need for access to mental health services, especially in Spanish for Hispanic families that live in Orange County. So I'd like to invite Diana Huerta to share her story. Good evening, everyone. My name is Diana Huerta. I'm from the St. Thomas More community, and one of the needs that we have in the community, in the Hispanic community, is mental health. I could offer a lot of testimonials from a lot of people that I know, but I don't think that I would finish this evening. Mental health is a big need right now in Orange County. Before, we used to have the Futuro Clinic, but they moved it to Durham. Now it's more difficult to get an appointment, to get help. Here in Orange County, there are clinics, but they only offer services in English. And many of us, especially when we're from other countries, we face a lot of fears. We have panic attacks, anxiety, and depression, not just as parents, but our children have problems like this too. And we as Hispanics, when we don't speak English, it's difficult for us to find places because maybe my child could get help, but we as parents need help too to be able to support our children. And the problem is the language. So for a lot of people, it's transportation to Durham is another issue. It's difficult to get out there. So there's great need in Orange County. It's something that I would like for you to take into consideration, given that sometimes the waiting lists are long. And when depression hits, it's difficult to tell somebody, wait, there aren't appointments available, or to go to a clinic, but the language is difficult. I'd like to ask you today to think about a moment.
Ahorita estamos pasando por la pandemia. Creo que la mayoría
Pandemic. I think that most people at some time have felt depression or anxiety. And I think that's it for the moment. Thanks very much, Diana. And now I'd like to invite Evelyn Ramirez so she can share her story with us also. Good evening, everyone. I'd like to speak particularly about mental health. I'd like to underline again the great need for education, for awareness when it comes to mental health and access to mental health services. Professionally, I work with a lot of families that are suffering from the effects. Even before, there's a lot of segregation, a lot of loneliness because of moving to a different country, because of a different language, because of economic problems. All of this brings about emotional problems in families. And when there's not a mom or a dad with adequate mental health, we know that we're going to have children with mental health problems. So when they're seeing their parents who are sad, angry, with anxiety, the child is going to have a reaction to the behaviors that they're seeing in their parents. And not having a clinic in the community, not having access to services in Spanish, where all families, because most of them don't have medical insurance, they can't find a place to go until it's too late. There are families that have young people who are suffering from anxiety, depression, a lot of families who have suffered the loss of a family member by suicide because they didn't know how to help them, how to lift them up, how to get them the help that they needed when they're suffering from a mental health problem. They don't have the opportunity to take the child, the young person, to a medical appointment until there's a big emotional explosion that forces them to take them to the hospital. And when you get to the hospital, it's another oasis that you got to get through. There's a lot of need. So this is a call for our families, and young people need a place that will help with their mental health. To have a safer community, a community where we have families and young people that can contribute to the community.
Thank you so much, Evelyn, and thank you everyone that has shared stories about affordable housing identification, education and youth, criminal justice, and mental health